Welcome back. We still have Mary Kamau, Director, Nursing Services at the Nairobi Hospital in our studio. Such a privilege. It's a great privilege having you here in our studio today as you're talking about Infection Prevention Week for this year, because we need to learn more. And even as we were on that break, we're just having a conversation with you in terms of preventing these infectious diseases when it comes to children. How do we train them, and how do we ensure that every area of their lives, whether they are, is well protected when it comes to preventing infectious diseases?
Yes. Okay, what happens to the children? You find that there is no way you can prevent them from going to pray, but how you protect the children first and foremost is to ensure that they are given the vaccines, the vaccines that protect. If it is for typhoid, this is for measles, all these vaccines that the government has been able to provide, so the child is protected. Number two, the parents also need to educate their children about hand washing. Like you find that even when they are going to nursery school, one of the things the teachers teach them is before you eat, you must wash your hands. You must make sure that your hands are well cleaned. And then the other thing is, as a parent, you also must make sure that the environment in the house is well taken care of. The house is clean. Where the child is sleeping is clean. The food that they are eating is fully washed properly, and it is fully cooked, so that when the child does not get, but you cannot tie the child in the house. So those are the measures that you can be able to do. And I believe also our teachers are also helping the children by showing them basic things. Also tell the child it's very important for a child to take a bath. So when they come out from praying, wherever they have been praying, they take a bath, because just a general wash that will remove a lot of microorganisms.
Yeah, and you know, when you're saying let the child be, yes, let the child play. Yes, because there are those two cautious parents, yes, you know, who are like, don't touch, don't eat, do this, do that. Yeah. So how can you balance it? Let the child be, at the same time you're cautious about your child getting some of these infectious diseases.
Yes. It is just that what I've mentioned, that yes, the child will have to mingle with others, and by the way, when they go to school, you find they come in with a lot of flu, common cold, because you can't prevent that. Even others get the rings on the head. But what, as a mother, you can do, as a parent, you can do, is to make sure that children are immunized at the time they are supposed to be immunized. Then they are eating healthy. Ensure that the children are having balanced diet. At home, they have the vegetables, the fruit, and also the water. They must make sure that they are eating well. The other thing is hygiene, making sure that even the toilets at home, they are well cleaned, and also teaching your child that before you, even if it's in school, be careful and how you even wipe yourself. If it's a girl, how do you wipe yourself? So these are little measures that you can tell the parents to teach the girls, and also the other children, the boy child. So I think that is what is very important. Cooking food, very, very important, and cleaning. Yes, that is what I can.
So when you talk about cleaning, I'm thinking about the fruits, you know, the vegetables, the kales, the spinach. Like when you're talking about cleaning the food that a child is supposed to eat, how are you supposed to clean it? Like if I'm washing mango, avocado, oranges, how am I supposed, should I take that as Scotch-Brite and Sugua, soap and water? How am I supposed to clean it?
Ideally, by the way, fruits can be very dirty. And you know, in Nairobi, we buy fruits which are coming from all sorts of areas. Sometimes they're put on the street. So you find that you're supposed to put that fruit, whatever, except the banana. You put that in water and you clean, thoroughly cleaning with even soap. Clean nicely, then you rinse that fruit so that the child is able to feed well. So all the fruits that are not peeled, you make sure that they are properly washed. And that is how we can. And even the greens, make sure that you take leaf by leaf and you clean, because there are even also parasites that are there. And then after they are there, they dry them, and then you cut.
And it's not the norm of just open the tap.
No. You have to literally have friction. You clean the fruit with a bit of friction. Okay. Yes, and make sure that all the dirt has come out, and you rinse properly. Then you leave it, and then it dries, and you give the child to eat.
All right.
Yes.
And you know, as much as we're here, you know, educating our views, and I'm also learning a lot from you, by the way, in terms of how to prevent these infectious diseases. What are some of these infectious diseases? What are some of the challenges that you're facing as a country when it comes to prevention of these infectious diseases?
Okay, what happens sometimes is lack of resources. So you find that we have our facilities that are very, very crowded. And you find that even if you are supposed to isolate people, somebody who has got an infectious disease is supposed to be put in an isolation. But sometimes you're not able to do that. So you find that that is one of the reasons. The other thing is about the staff. We have got shortage of staffing, particularly nursing staffing, or in the country. So you find that one nurse who is supposed to take care of maybe 6 patients, 5 to 6 patients, is taking care of even 40. So you find that it's very overwhelming, and that really can bring in a lot of problems.
Right.
The other one is also supplies. Sometimes you find that some of the facilities are not even having the supplies that they need to have gloves for the staff to use to be able not to cross-infect. They also need to have cleaning solutions that are supposed to be supplied. So you find that this also brings in a lot of challenges. So, and maybe probably the government need to organize about the supply chain. How are these things purchased, and where they get to the common mwananchi and in the hospitals to be able to be taken care of.
Right.
Another thing that also is a big challenge is about data. We are not able to collect data well. We still need to work on our technology so that we can be able to say we have been doing surveillance and we know this is the type of infections that we are having, and this is how we can tackle. So we find that data collection is still not very well done, and we are doing it manually. So we need the government to help in this technology. And also the other thing is about research. We are not doing enough research. The other thing that we also have, another challenge is about policies. We find that we do not have enough policies, or the government is trying a lot to do policies of infection prevention, but they are not enough. We still need the government to do more so that at least we have policies. The other thing is about education and creating awareness and capacity building. So you find that sometimes like in this country, we do not have a course that is specifically said this is one for infection prevention. We don't have a college that is having, like, for example, a degree in infection prevention in this country. So you find that if you are to do, you have to go out of the country, either UK or other countries. So I think the government need to invest on that, and we make sure that at least people are taught and there is capacity building. From hospital institutions, we are trying, like for example, the Nairobi hospital, there's a lot of training in terms of infection prevention, but now that is just one area. I don't know, the other, and even the other county hospitals are also trying, but we need to build more capacity in that. So I think there's much that we need to do in terms of policies, in terms of research, in terms of disseminating that research, in terms of even doing audits to see what exactly is happening. I know we report some of the communicable diseases, like cholera is reported, even COVID was getting reported, but that data, is it disseminated to all of us? That is maybe what could be a major concern, a challenge to us.
And you know, when you're talking about Nairobi Hospital being one of the hospitals in the country that has really maintained that, you know, prevention in terms of avoiding infections. You know, when I go to Nairobi Hospital, I usually see doctors throughout, you know, even as the numbers of COVID-19 has gone down, throughout with masks. You know, before they attend to a patient, they sanitize. The patient is there, you to sanitize. You know, it's just one way. But then, which brings me to my question. Some of these infectious diseases, you're saying that it needs isolation. Of course, COVID-19, we know you need to be isolated for some time until you are tested to be negative. Then you can interact with your family or your friends and fellow Kenyans. But then now, what if someone has flu? Someone has a child has measles or ringworms? How do you isolate this kind of a person?
Normally, we have got conditions that are marked for isolation. Somebody who has got active TB, pulmonary TB, that is the TB in the lungs. When they come to the hospital, the first thing, even from the time they come at the reception to be admitted, and they are coughing, usually the nurses are on the high alert. You'll be given a mask there. As the triaging is going on, you are given a mask to make sure that you don't cough into other people. Then from there, you be triaged, and then you are put straight in the isolation. You are put on medication. Of course, the test will be done to identify what kind of condition you are having. If it is, for example, that contagious condition like TB, then you are put on treatment. And until you have been put on treatment for about 2 weeks continuously, and you cannot be de-isolated. So you'll be put in that isolation area. People who have, of course, like rotavirus also for children, they're also isolated. So you find that there are some other conditions like common cold. They don't necessarily have to be isolated. But those conditions are already marked that these ones you have to be isolated.
So I'm just looking at this scenario. Probably you're coming from a low-income family within the slum areas, dwellings. You live in a small room. Someone has diarrhea, another person has rotavirus, a child, and then we have TB. So how do you isolate this person?
This is usually very, very tricky. It is tricky because now we are talking of this person is with you people in the rooms. Like when we did COVID, we still tried as much as we can. We have an area room. People were advised to be isolated in the room, but it is difficult because there you could admit in the hospital. Even now, even in the very low income, we definitely advocate for patients to be admitted, because in the hospital, even if it's a Bagathi, they still have isolation areas. But then again, the other thing is ensuring that the measures of, say, for example, hand hygiene are done. If, for example, you are coughing, then you use the cough etiquette, ensuring that you do not spread to others, and also use a cloth when you are coughing. That will also prevent. But you find that in terms of isolation and in this people living in the small room areas, that can be very, very challenging. However, we have the hospitals and they are even given treatment. But some majority of these conditions, first, when the treatment is started, within a very short time, you find that the infectious phase of the disease goes down.
Is it what you medics call like a viral load?
Yes, we find that there's a time when you find that when the patient has been on active treatment, you'll find that they go to another phase. There's active phase, and there's phase that they cannot be able to transmit the infection, but they are still continuing with the treatment.
All right.
Yes.
And so now what happens, even in terms of sharing, like TB, you know, one of the infectious diseases. So what happens in terms of sharing utensils?
No. Usually what
beddings?
What we normally advise and educate is that when somebody is on isolation, things are they are put separately. They have a bucket where they will be soaking the cups, the plates, and even their linen. So you usually have to teach the people on measures on how to be able to isolate. So because these are not things that you are able to, they will have their own dustbin, and then this dustbin, of course, has to be aligned so that it is tied nicely, and you make sure that the person is kept aside. Yes.
Right. Wow, that is quite educative there. So what are some of the causes of the challenges, and how can we confront them so as to have a new infection-free society?
Some of the challenge, the concern, I have talked about the challenges that we have, and I said one of them is policy. So policy making. So what we can confront is make sure that the government get involved, the policy makers are involved. You find that everything is able to get and to pick up well if the top management are involved. So we make sure that at least the policies are made, and once they are made, they are cascaded to other people. The other thing is about, of course, trying to get the staffing, because we said one of the things is overwhelming of the workload of the team that are there. I think the government need to employ and even in our hospitals, we try to employ as many staffs as we can. It is, of course, economic hard times, but it is important that we try to stick to the national guidelines of how many patients should be taken care of by a single nurse.
So that at that point, then can we bring in the conversation of the community health workers?
Yes. The community health workers come in very handy, because when you discharge the patients from the acute phase in the hospital, we usually hand them over to the community health worker, so that they're able to follow them, and they're able even to help with isolation, nutrition, they're able to guide and all that. Yes.
All right.
Yes. So those are the areas that you find that we can be able to mitigate. And of course, we also think that we need to do a bit more in training. Even if the government, we don't have a school, for example, schools, we do our own way of making sure that we are creating awareness and teaching the young ones. Even this should be even put in schools, so that
in the curriculum?
Yes, in the curriculum. It should be included in the curriculum, so that by the time the child is even getting in school, they are understanding about infection prevention and ways of how we can be able to help, and to know the importance of infection prevention, and even simple things like hand washing.
All right.
Yes.
All right. And you know, Nairobi Hospital is a premier healthcare facility in Kenya and the region. So how do you prevent infections to your day-to-day operations? Because I mean, you meet different patients.
Yes.
You know, probably I'm just trying to wonder, probably a patient comes in and tells you, okay, I think I have COVID. And of course, as a health worker, it's not like, oh, okay, I know there's a way you take the patient through, and also yourself. So how do you ensure that you prevent this infection?
Okay, Nairobi Hospital is aligned to international standards of infection prevention. One, we have got a lot of water points or hand washing points, because we have agreed here earlier on that one of the simple measures is hand washing. So from entrance of the hospital,
I've actually seen them.
Yes, you'll have hand washing points, and we encourage, and you have always running water, you have soaps to clean, so you should ensure that is there. So then the population are told. When you go even to the wards, you find that before you get to every room, there is a hand sanitizer there. So the visitors are encouraged, wash your hands or sanitize before you go into the patient. The other thing that we ensure is that we have got safety measures, like for example our waste segregation, which is one of the fundamentals. We have got strict measures of how our waste is segregated. We find that whenever, say for example, you have injected somebody, at that source you don't move along with the needle holding. At that point, so the nurse has been trained in a way that they'll carry the sharps container and they'll put the sharps there. The other thing is about cough etiquette. We have been able to train our nurses. Like now this week, every single department were even demonstrating, teaching non-clinical team, the guards, the people in maintenance. They are taught.
I was even about to ask you as we wind up.
Yes.
You know, what activities is Nairobi Hospital engaging in terms of this week when you're talking about prevention, preventing rather infections during this week or as we celebrate this important.
The Nairobi Hospital has really aligned many things. First, in the first day, we launched the infection prevention week, where many nurses were there, and we find that we have got a lot of infection prevention team, a big team, and liaison. So that we launched that, and then we had one of our head of nursing, she's called Jemima. She was at Classic 105 teaching the public about the infection prevention. We also went at every entrance of the hospital. We had people who were stationed to teach the community, to teach the people who are coming in about hand washing, the importance of hand washing, and the steps that we are talking about, so that they are able to see how it's done. And the other thing is about in the departments, we went from each department to the other, demonstrating about the hand washing and the simple measures of the fundamentals from injections and all that. That was also done. And then after that, on Wednesday, yesterday, we had a CME that was organized. We were given a continuous medical education, a session that we were given by the person from the Ministry of Health to check about staff safety, and which include infection prevention. And then like today I'm here
and we're really happy that Nairobi Hospital is here.
Yes. And then we also have organized a CSR activity at the Donholm Primary School. This is a public school which has got about 2,000 pupils. And these pupils are going to be demonstrated. Actually, as we talk, they are there. They are to be demonstrated about hand washing, importance of hand washing, and we know once they are out there, they can go to 2,000 families. Yes,
Thank you so much, Mary Kamau, Director, Nursing Services at the Nairobi Hospital. Like, pass our regards to Nairobi Hospital staff.
I will.
Tell them they're doing an awesome job, and thank you for accepting our invite to be here today.
Thank you.
Mary Kamau, Director, Nursing Services at the Nairobi Hospital, teaching us. I've also learned a lot. Teaching us about infection prevention diseases, how we can prevent them. I hope you've also learned a lot of views this morning, even as we talk about Infection Prevention Week. My name is Brenda Zederadito. Thank you so much for watching. I leave the studio right now and pave way for my colleague who's coming up next with Yanayo Jiri, bringing you up to date with what is making the headlines in Swahili language. I see you. Actually, it's not even Yanayo Jiri. Goodness. Justina, Director, thank you so much. It's actually New Center. Yeah, New Center. But we're not having New Center here. We are on the ground in Kericho County, where Mashujadi is supposed to be happening tomorrow. So Fatia is there, and will be giving us more updates from the ground in Kericho County, the county of the Kenyan Rich Tea. So I hand you over to my colleague, Fatia.
We've been